Two-thirds of the population in Africa rely on healthcare supply chains that are either managed by a government, donor-funded organization, or a mission organization. This means a few organizations are responsible for how a big part of the population accesses these healthcare products. For this to happen, this organization needs to have a certain level of efficiency that can only be data-driven. So our work in Xetova is to work with these organizations to help them use the data they already have or the data they don't have access to in a simple, seamless way to improve their internal processes or their collaboration initiatives so that they're able to make sure what is needed is where it's needed without wastage of resources. Simply making sure that the patient who is dependent on this supply chain has access to what they need when they need it. So we close the loop of access to primary health care. A case in point is the Ministry of Health in Kenya, where they are coordinating how about 1,200 products, 30,000 SKUs make their way to about 7,000 hospitals, and it provides services to about two-thirds of the population. With a vast amount of data they have collected over the years of distribution to these hospitals, Xetova has been able to provide simple solutions that has profiled this supply chain and has integrated back the insights that the Ministry of Health requires to be able to provide the foresight and the insight in how these products are being consumed so they can reduce wastage from expiries, so they can reduce the reflex in emergency sourcing where they reduce the cost of how they procure and when they procure. Currently, we are working to scale the work that we've done in Kenya in about 10 countries in the next 12 months. And this work is simply to build their capacity to know the threats of their supply chain and how to better use their resources to simply make sure what is needed is where it is needed without wastage of resources.